Let's say that you've just entered the medical field as a pediatrician. 8 years of schooling and 3 years of gaining experience, you're an eager doctor who is ready to get started. However, you quickly discover that due to the never-ending line of patients in government control, you work day and night as hard as you can with little flexibility. But despite your greatest efforts, your salary is too similar to the passionless doctor next door. You also notice that many times your patient's needs are rarely cases at all, but rather a concerned mother who is overreacting. I believe that universal health care for the United States is both impractical and undesirable. The House of Representatives has proposed universal health care in order to provide affordable, quality health for all Americans and reduce the growth in healthcare spending. Establishing a universal healthcare system will reduce the quality and drive, as well as flexibility of our healthcare due to the lack of competition. With competition comes determination, and with determination comes success. Without the persuasion of competition, quality and flexibility of our healthcare are lacking in the proposed healthcare system. I think everyone would agree that if you were a doctor, there wouldn't be as big a strive to be all that you could be, to only be classified along with every other doctor in your field. You would not try nearly as hard to reach your full capability if you were only to make the same amount of money as one doctor to the next. When the government is involved with something, politics seem to always be associated with decision-making. Various steps will have to take place in order to keep healthcare costs under control. Also, countless rules will need to be put into place to determine when doctors can perform expensive tests and when drugs can be given. Universal healthcare will not only reduce the quality of our healthcare, but flexibility as well. Due to the large lines of people waiting to seek medical attention, doctors will not have flexibility in their schedules. But the problem with flexibility does not only affect doctors, but patients as well. It will take more time than ever to seek medical attention. Bill George states that in Canada, where they have established universal health care, it takes up to 7 months to get treated, and many Canadians come to the United States, pay more money in order to get care faster. Also, since a visit to the doctor is free, many will take advantage and go to the doctor for a single cough or the common cold. When you first look at the universal health care, it seems to increase the patient flexibility. After all, you are entitled to visit any doctor you desire. However, with universal health care comes other various problems. Will LASIK eye surgery be covered, breast reduction for back problems, or a nose job to fix a bump from a car accident? Medical procedures will come down to an argument of who qualifies and who doesn't. Which brings me to my next point. It will be a painful process to switch to universal health care. It will create unnecessary responsibilities and lessen job opportunity. A universal healthcare system is a burden on the American people as well as the government in several ways. As stated before, there will be an ongoing debate about what universal healthcare specifically covers. Also, the process to start universal healthcare will be a messy one, with countless files, papers, more laws, more taxes, and new patient records. Universal healthcare has no need for health insurance, therefore depleting an entire field. Many workers at hospitals who dealt with insurance would lose their jobs. Why take millions of jobs from innocent people? With universal health care, America will see a loss of private practices, possibly discouraging future doctors from further pursuing a career, along with others going into the medical field. And lastly, universal health care leads to many financial arguments. It isn't really free, but rather expensive. In the first 10 years of starting the program, we will spend $100 billion per year, states the healthreform.gov. This adds up to nearly the cost of the war in Iraq per year. We will still have to pay our medical bills with higher taxes. And possible spending cuts will come from other areas of government spending, such as education. Overall costs in healthcare will be several times more due to people taking advantage of the universal plan. Forever ache, pain, or cough, Americans will go to the doctor for what they normally could have just taken a simple pain reliever for, wasting doctors' time, other patients' time, and wasting our money. Universal health care. With universal health care, you will pay a little more than the average insurance. Is this fair that we pay extra taxes for someone else? Universal health care will be extremely beneficial to the select few who have major surgeries and illness. However, this is only hurting the perfectly healthy people who must pay for our neighbors' flaws. Today I have covered why I think universal health care is both impractical and undesirable. So the next time you decide whether or not universal health care is a good idea, think about it. Is it really worth it?